my name is Elizabeth. I'll be your nurse for today. How are you today? That's great to hear. Just to make sure and cover everything Dr. Lee has mentioned, your dermatologist, you have scheduled a surgery for today at 10 a.m. to remove the basal cell carcinoma or cancer on your cheek. Just to let you know, for further information, basal cell carcinoma is a type of skin cancer that is exposed by UV radiation, basically from the sun or indoor tanning. This type of cancer will look different on everybody. Sometimes it can look like open sores, red patches, pink growths, elevated scars, or shiny bumps. At times, the lesions can form pustules, which are pimples with pus, and that can cause a oozing or bleeding when it's itched. And for today, the surgery is done by a procedure called Mohs. Mohs surgery is done in different stages. So in the first stage, Dr. Lee will examine your epidermis, or the outside of your skin, especially on your cheek where the biopsy was done. Dr. Lee will then place a surgical drape over your face and will have a hole open on your cheek, and she will inject local anesthesia onto the cheek to numb the area. And with the scalpel, Dr. Lee will remove a thin layer of the cancerous tissue and send the tissue to a pathologist for lab analysis on the tissue. So everything will be done here at this clinic, and while the tissue is sent to the lab, your wound will be damaged as you temporarily wait for your results. Meanwhile, the pathologist will freeze and cut the tissue into sections and dye them to easily map where the tissue was removed from the wound. And during the microscopic examination, Dr. Lee will examine all the edges and even the undersides of the tissues on the sides to check if there are any cancer cells left. However, if there are still cancer cells remaining, Dr. Lee will mark the area and will let you know if she needs another layer of tissue removed. So the same thing will happen between multiple rounds, just until there are no cancer cells in the tissue. And if multiple rounds are needed, the procedure will take longer than usual, and it could last up to 3 to 5 hours. Once the area is clear of all cancer cells, Dr. Lee will close the stitches and close the wound with stitches. And depending on your wound, the risk of scarring does vary depending on how widespread the cancer is. With this said, it is very important to practice a routinely wound care and to follow discharge instructions to minimize the risk of permanent scarring. It is also crucial to protect yourself from the sun as much as possible, because basal cell carcinoma does have growth patterns that can cause a lot of damage, and the best way to minimize this damage is to continuously stay out of the sun as much as you can and apply sunscreen. Fortunately, Mohs surgery does conserve the greatest number of healthy tissues and can give the smallest scar possible. Do keep in mind, again, that it's very crucial to take care of your wound and follow all instructions and have a consistent scheduled follow-up appointments. The best time to return to have your stitches removed will be 7 to 10 days later, and after your procedure is finished, we will discuss and determine the best day for you to come back to get your stitches removed. So before we enter the surgery operation room, do you have any questions about the procedure? If not, I will lead you to the operating room and help you get prepared for the surgery.